Nothing that you do or dream up can ever change that.
Gatsby. He had a grand vision for his life since he was a boy.
I'm gonna fix things just the way they were before.
Just you and me. No amount of fire could challenge the fairy tale he had stored up in his heart.
Will you still love me when I'm no longer young and beautiful?
Is all this made entirely from your own imagination?
When I got nothing,
But I had the uneasy feeling that he was guarding secrets.
I know you will.
I wish I'd done everything on earth with you. I don't want to go.
And don't.
Last green light in my eyes, and my love on my mind, and I'll sing from the beginning.
It had gone beyond her. It had gone beyond everything.
Something ought to be done about a fella like that. My life has got to be like this. It's got to keep going on.
Welcome back to Western New York Tonight. I'm your host, Tammy Lee Demler. We're here also joining those on 90.5 FM, WLNF. We have Dr. Gale Burstein here. It's such an honor to have her back. She's the Commissioner of Health at Erie County, sharing her expertise in the area of immunizations and preventable illnesses and being well all around. We talked a little bit about rabies, but we're going to come back to it. And we're going to take a break and talk about shingles now, because that's really a widespread concern. There's a lot of media sensationalism out there now about getting your shingles vaccine. Where does shingles come from? So I'm going to turn it over to you as the expert. What is that term? What is shingles?
Well, shingles is actually a syndrome that's caused by the virus that causes chickenpox. So if you're over 40, there's 99% chance that you had chickenpox as a child. And even if you don't recall it, or if you had a very mild case, you might not even have known that you had chickenpox. Almost everybody over 40 has had chickenpox, has been exposed. And so what happens is, the chickenpox, the lesions clear, and we feel, hey, we're done. But you're not done, because the virus actually never really clears our body. It just goes inside and hives in our nerves. And then later on, when we have a very, our body goes under a lot of stress, either physical stress or immune stress or psychological stress, anything that would weaken our immune system, it comes out and causes shingles. And so I think probably most people have heard what shingles is. It's a very, very, painful syndrome where people break out with these very, painful sores, and they're blisters initially filled with fluid, and then the blisters burst, and then you have these kind of open wounds, and it's just terrible pain. Burning sensation. People tell you that it's really the worst pain they've had in their life. Many people are in so much pain they can't even sleep at night. It's just really awful. And it can take, if you're lucky, you'll be better in a couple weeks. If you're not lucky, it can take weeks, even months. And usually, since it is a virus that infects the nerves, it's usually the sores are distributed along the path of a nerve. So you might see many times, people who will have, say along the nerve path of along the chest or the trunk. Unfortunately, it can also occur along the nerve path along the face, and up to 25% of people who develop herpes can get involvement around or in the eye. So that can be very, very serious. So that there is, and unfortunately, there's even a complication to shingles called post-herpetic neuralgia. So even after the sores heal and your skin is fine, people can develop this painful syndrome that can last for months or even sometimes forever, and there's no treatment for it. It's really awful. So but fortunately, shingles is preventable. Even though most of us over the age of 40 are infected with the virus that causes shingles, we can get another vaccine, the Zostavax, to prevent the outbreak of shingles. If we are at risk, if our body for somehow is immune system is weakened and we are at risk of developing shingles. Even just age is kind of the number one predictor of getting shingles. I mean, by the time somebody's 85, they have about a 50% chance of developing shingles.
Wow. We
know there are about 1 million cases a year in the United States, and even if people are fine and healthy, they have about a 30% chance of developing shingles sometime in their lifetime. So it is actually very common.
I have a little story because we always, as moms, can share these stories.
Sure.
I got to tell you, when my son was 14, he had shingles.
Ooh.
And it started on his back, and who knows why that happened. He was 14, maybe a little stressed with school, maybe not getting a full night's sleep, and didn't even have a severe case of chickenpox. But I think it's interesting for the audience to know that when I first saw it, I thought it was mosquito bites at first. I'm like, how would they all, like that? And then I'm thinking, oh my gosh, bed bugs. I was petrified. But then they got to be oozy and vesicular, and I thought, it can't be shingles. My son is such a little kid, but it was, and they put him on Zovirax at the time.
Right.
There was no Valtrex really that they were using. And so that helped him. So there are things to do that help mitigate it if you get it, right?
Right. There are antivirals that can be taken that can help decrease the severity and pain and also the duration of pain. But it's really important to start those antivirals at the very, very onset of the outbreak. So if you suspect you may have shingles, you have to go see your healthcare provider immediately, because if you do have shingles, the medication is really only going to work if you start in the first couple days after the outbreak.
Hard to necessarily think shingles, though, unless we have programs like this where you're educating us that exactly what to look for. It's just a little patch. It's not necessarily a huge, big spread. I mean, I'm sure everybody's different, but certainly if it's any kind of facial involvement, you need to get help right away. You had mentioned the word herpes. I always think that makes everybody think, oh my goodness. But describe the nature of chickenpox as herpes. It's just a different kind,
right? It's in the class of herpes virus. There are many herpes viruses, and chickenpox, the virus that causes chickenpox, shingles, is in that class. So again, we're all familiar with herpes. A lot of times they can cause cold sores around people's mouths, and people get these cold sore outbreaks around their mouth when they're under stress. It's the same concept.
So at least we know that it's okay. It's just a different kind. I want to talk about the risk. Truly, you didn't mention that it's hereditary, and is there a link in that way? It's just really stressful.
Right. It's just if
weakened
one's
immunity?
immune system is weakened because, again, say you're ill for another reason, or people who are going under like chemotherapy, or they're taking other medication where their immune system is weakened. I mean, those people are at risk for developing shingles, or you have like a very, very lifetime stressful, psychologically stressful situation. Again, that weakens your immune system and gives the opportunity for the zoster virus to come out and cause shingles. Unfortunately, it's kind of contradictory because there is a vaccine, the Zostavax, that will prevent the outbreak of shingles. It will greatly reduce the risk of developing shingles. But the contraindications are, again, people who are immune compromised, so people that are getting treatment for cancer like chemotherapy or other medications, say for rheumatologic disease, some type of steroids or anti-inflammatories, or pregnant women. Those people should have a weakened immune system, are not eligible to get the vaccine.
So better to get it while you're young and healthy, right?
Well, it's better to get it when you're healthy. The vaccine is really recommended for people who are 60 and up.
Okay.
It's actually FDA approved, so it's licensed to give to people who are 50 and up. But the Advisory Committee for Immunization Practices that makes the recommendations for immunizations, for prevention, felt that it was really most cost effective to offer it to people who are 60 and up, because that's when we really start to see the incidence of shingles increase.
And you're still healthy, and you can still take it.
Right, sure.
I
You
know.
can be really healthy at 60.
Absolutely. People, is this covered by insurance? Because I know it's relatively new, or at least it's been in the media recently. People are more aware of it now, and we'll talk about pharmacists can immunize with that now, so you can almost go to any place to get it.
Right, right. Well, we're lucky in our area. I've been told that the Medicare Part D covers about 90% of people that are who want the shingles vaccine. Yeah, it's also very accessible because, as you pointed out, that pharmacists can give the vaccine. You do need a doctor's prescription, but you don't have to go to a doctor's office to get the vaccine. You just need to walk in with a prescription, and the pharmacist can give you the vaccine. And it's just one dose.
I was going to ask.
One dose, and you're good.
So you can handle one dose.
Right.
It's not too bad. What are the side effects to it? I know I've asked you before about the rabies. What would you expect? Pain at the injection site? Any other unusual things?
Well, you can actually get like some sores that are similar to what you might see with shingles, as on occasion. So you just want to make sure you cover those up because they can be open sores. But those are the most common side effects.
We're getting close to a commercial, but I'm going to ask you a question. You can say, well, I'll take it at the next segment. With now more and more kids getting the chickenpox vaccine, what do you think that the outcome of that will be in terms of having any shingles in the future? I mean, are we sort of outsmarting the virus by not having active wild infection? Or are people who get that shot susceptible because they've got that injection?
Well, the problems with the varicella vaccine for children is that we're not really sure how long the immunity will last. So there may be a time when they already recommend one booster. So kids are entering school should have had two varicella vaccines. But we don't know if if that's protected through adulthood. So time will tell. The Centers for Disease Control and Prevention is looking at that through their vaccine monitoring systems. But we are at risk of, say if an adult gets chickenpox or the virus that causes chickenpox, they can become very ill.
Barbara Walters just had chickenpox. I don't know if you heard that, but I was like, that's a perfect example that some people may not have been exposed and are at risk. So we'll talk about what to do if you're in Barbara Walters' position and what you need to do to be able to see if you've ever been exposed, because there are ways to be able to determine that. But again, your website and a telephone number where people can call.
Sure, it's www.erie.gov/health. Okay. And it's 716-858-6976.
And we'll plug again, just before we go, for those listening on the radio, that you're having some rabies clinics coming up for families and their pets, May 22nd and May 29th.
Well, it's really for the pets.
Well, for the families and the family who owns the pet. May 22nd and May 29th. Different areas, American Legion Post by Amherst Street by the Wegmans, and then Erie County College South Campus, and people should know where that is. Adjacent to Erie County DMV?
Right.
Okay, perfect. We'll go to break. We'll come back in just a few minutes. The family who owns the pets, or the pets that own the
Mr. Gatsby, I'd like to know.
Exactly who are you, anyhow? Can't you see who this guy is? With his house, his parties, and his fancy clothes. We were born different from you.
It's in our blood. Nothing that you do or dream up can ever change that.
Gatsby. He had a grand vision for his life since he was a boy.
I'm gonna fix things just the way they were before.
Just you and me. No amount of fire could challenge the fairy tale he had stored up in his heart.
Will you still love me when I'm no longer young and beautiful?
Is all this made entirely from your own imagination?
When I got nothing,
But I had the uneasy feeling that he was guarding secrets.
I know you will.
I wish I'd done everything on earth with you. I don't want to go.
And don't